Good afternoon. My name's Karen, and I'm going to talk to you today about Meniere's disease, which is a debilitating disease that affects the inner ear and the hearing and balance of the person who suffers from it. If someone you know or love or yourself suffers from Meniere's disease, I hope that today is helpful so that it explains the symptoms, the causes, and the treatments that are out there to help people who suffer from Meniere's disease. It's got another fancy name called endolymphatic hydrops, which just basically means that you've got too much fluid in that inner ear, and that fluid bursts from the place it should be and damages the surrounding sensitive tissues of the inner ear. The two systems affected are the cochlea, responsible for hearing, and your vestibular system, which is that intricate three semicircular canal system responsible for your balance, sensing where you are in space. Damage can be intermittent or permanent, depending on if you have recurring attacks of Meniere's disease. It affects about 1 in 190,000 people in the population, and for whatever reason usually affects more women than men. The average age of onset is between 40 and 60 years of age. The symptoms can be mild to moderate to severe, and people with severe Meniere's often have debilitating symptoms and something known as drop syndrome, where they completely fall to the floor because they lose that sensation of where they are in space at the drop of a hat. The symptoms of Meniere's that physicians look for is a feeling of fullness in one ear. Usually it affects one ear rather than both, thank heavens. Another symptom that they look for is ringing in the ear, usually the lower frequencies, and this is called tinnitus. The third symptom that they look for is hearing problems, loss of hearing, which can become permanent. And that fourth symptom is rotational vertigo, where your world is spinning, and it can be often very violent. The disease itself is known as an idiopathic disease, which means they don't really know what causes it, but there are several suspected causes out there. These range from anything from head trauma to dietary or lifestyle implications, such as too much salt, not enough potassium, caffeine, stress, too much alcohol, nobody wants to hear that one, and other factors such as potential for there have been damage to the inner ear by respiratory infection, causing a narrowing or blockage or scar tissue of those very delicate small vestibular channels. Luckily, there are a lot of treatments out there for Meniere's. People who have allergies sometimes can exacerbate the symptoms of Meniere's disease because it causes that excess buildup of fluid as an allergic response. So treatments can vary widely. Even the herpes virus has been implicated in Meniere's disease. Many of the treatments, they fall into 4 categories. The first is diet and lifestyle recommendations, the first and easiest, non-invasive therapies. The second is intervention by specialized therapists trained in vestibular rehabilitation. The third is medication. And the fourth is, last but not least, surgical intervention. Dietary and lifestyle recommendations include reducing that caffeine, reducing salt intake, increasing your potassium, everything including diuretics, those medications that can try to reduce excess fluid that builds up in the inner ear, causing those delicate things to burst. Other treatments are vestibular rehabilitation specialists who manipulate your head in various ways to try and move that fluid back into the places it should be to promote homeostasis and proper balance functioning. Thirdly, there are several medications. Some are controversial. Diuretics is one of them, just because it reduces that fluid that's in the body. Another one is gentamicin, very controversial because it actually chemically kills the vestibular system, that labyrinth in the affected ear, permanently, thereby not sending the signals to the brain from that affected side. So last resort, really. Another is treatment for the herpes virus with the drug acyclovir. Last but not least, there are surgical interventions. A newer one that promises to be promising is an insertion of a small tube surgically. And then the patient self-administers microbursts of air into the inner ear. Imagine that. That just create disturbance in where the fluid is and promotes homeostasis in the inner ear functioning so that you have balance back. Other surgical interventions are labyrinthitis, where they completely remove the labyrinth, so you've only got one good side working. Very drastic, but sometimes necessary. and cutting of the nerve that sends the signal to the brain so that you only have one functioning side. Surgical interventions are usually the last resort, and your physician is the best one to determine which of these recommendations work for you. Allergy therapists are also involved in the treatment of Meniere's because they try to desensitize the body to substances that can be increasing that fluid in the inner ear. So regardless of what the cause could be in your case, help is out there. Please see your physician. Many treatments are available for this often debilitating disease. I recommend a fantastic book by Neil G. Bauman called The Agony of Meniere's Disease. Please make my world stop spinning. I hope this has been helpful to you today. Thank you.